Hi ho, this is research methods in nutrition 4. We'll be looking at investigation methods in human nutrition. My name is Dr. Jumoke Georgina Ilo. Our outline will focus on major classes of nutritional investigation methods. Investigation methods in human nutrition are the systematic procedures used to collect information on dietary intake, nutritional status, biochemical profiles, and also clinical signs related to health and disease. This method makes it possible to identify nutritional problems, to assess population health status, to monitor intervention, and also to understand the relationship between diet and health outcome. And oftentimes, we combine several investigation methods to achieve a comprehensive and accurate assessment. There are four types. We have the dietary assessment method, the anthropometric measurement, the clinical assessment, and lastly, the biochemical assessment. Each of these categories offer different types of information, and choosing the appropriate method depends on the research objectives, the population, the time, and also resources that are available. Dietary assessment method. Dietary assessment method make use of types and the amount of food or beverage consumed by individuals or population. It helps us to determine the nutrient intake, the dietary pattern, the dietary diversity, the potential risk factor for diseases. And because the diet can be complex and varies daily, the use of multiple methods are oftentimes used to capture accurate information. Under the dietary assessment method, we have the 24 hours dietary recall. 24-hour dietary recall involve asking a participant or respondent to list all food and drinks they consumed in the last 24 hours, and mostly it makes use of trained interviewer using probing questions to obtain details on the food type, the portion sizes, the timing of meals, the ingredients used in preparation of the meals. The recall is often conducted using multiple pass method, where you have a quick list of food consumed. A patient could give you a list of the food he or she ate in the last 24 hours. For example, a patient may record having egg and bread as breakfast in the last 24 hours, having rice and chicken as lunch in the last 24 hours, and then as dinner, taking maybe tea and pancakes as dinner in the last 24 hours. Then you have a detailed probing for forgotten items could help them to recall if perhaps they took beverage snacks in the last 24 hours that they have not mentioned. And there is need for estimation of portion sizes. You can use food models, you can use household measures. You could ask them the bread you had as a breakfast was how many slices of bread did you consume? What is the monetary value of the bread? Did you eat the full portion of the bread or you shared with a member of the household? Then you review to ensure completeness. The strength of this method is that it is quick and it's simple. It minimizes participant burden. The burden is mostly on the trained interviewer. Then you use it's useful for large survey, and you don't need to be literate before you can participate, because it depends on the success of it. It depends more on the skill of the trained interviewer. The limitations in this regard is that it relies largely on memories. If the participant cannot recall everything he or she has consumed, it have an impact on the outcome of the study. Then what is recorded may not reflect the usual intake, especially somebody who do not attend parties. Just by chance attended party in the last 24 hours, what will be and ate maybe different varieties of food, what will be recorded for such a participant will not be a true picture of the person's usual meal. It requires trained interviewer, and most times it is being underreported, especially among overweight participants. Food frequency questionnaire make measure the habitual or long-term dietary intake, and then it contains all the list of commonly consumed food. Respondents are asked to indicate how often they consume each items, and then within a specific period, it could be weekly, it could be monthly, and it could be yearly. There are different types of food frequency questionnaire (FFQ). You have the qualitative FFQ, which involve or measures frequency only. We have the semi-quantitative food frequency questionnaire, which includes the portion sizes of the food consumed. And then we have the quantitative FFQ, which give detailed frequency and also the portion size. The strength is that it captures long-time dietary pattern. We want to know the dietary pattern of population or respondent over a long period of time. It can actually be self-administered. You can give the questionnaire to respondents to fill by themselves, and then it's suitable for large epidemiological studies. Limitation include it's less accurate in estimating exact nutrient intake. When you compare with 24 hours recall, it's less FFQ is less accurate. It can be difficult to recall frequency of consumption of some food. It gives you frequency over a long period of time, and then it requires validation for specific population. You know, these are the limitations of this of FFQ. The weight food records. The weight food records involve participant or respondent weighing their food before they consume it. They weigh the food, they record it, and before they consume the food. And this is done over a specific number of days. It could be 3 up to 4, or up to 7 days rather. This method measure actual intake directly. Actually, it have high accuracy. You don't have you don't have the burden of recalling what you have eaten. You have to measure before you eat, and then it give you details information on the portion sizes and the food preparation. You know as you are before you eat, you weigh. If it is rice with egg or rice with meat or chicken, you weigh your rice, you measure it. You weigh your chicken, you measure it before you start munching on your food. um the limitation is that it's very time consuming. It takes you to sit down and measure all the food you want to consume. If you are consuming snack, if you are taking puff puff, egg roll, you have to measure every bit before you put it in your mouth. Another investigation methods in human nutrition is anthropometric measurements. And anthropometry measurement involve measuring the physical dimension and also the composition of the human body. It is actually the most widely used nutrition assessment method, and it is not invasive. It is not expensive. It is easy to use in the field premises, and then it's also suitable for all age group. Anthropometry measurement helps us to detect undernutrition, therefore wasting, stunting, underweight, and also for overnutrition, therefore overweight or obesity. It also helps us to detect if there is a growth disorder or body composition changes. One of the strengths of this method is that it is highly accurate. Another strength rather, is that it does not depend on anyone's memory. Body mass index is one of the calculation used to measure anthropometric indices. And body mass index is also known as the BMI, and it's calculated using the weight and the height. The formula is the weight in kilogram divided by the square of the height in meter square. The WHO classification for adults is the obesity greater or equal to 30, overweight between 25 to 29.9, normal is between 18.5 to 29.9, while underweight is between is less than 18.5. The strength for this method or tool is that it is useful for population study. You can use it for a large population, and then it helps to classify nutritional status. Limitation includes that it does not distinguish between fat and muscle mass. Someone can be in the category of overweight or obesity, but in the actual fact, the body do not have the level of fat that should categorize such a person under obesity or under overweight. And also, it's not ideal for athletes. It's not ideal for elderly and also for children. Mid upper arm circumference, also known as MUAC. MUAC measures the circumference of the upper arm and is especially valuable in emergency nutrition surveillance. Interpretation for children between the ages of 6 months to 59 months is that severe acute malnutrition will be less than 11.5 centimeter, moderate acute malnutrition 11.5 to 12.5 centimeter, while normal will be greater than or equal to 12.5 centimeter. This method is very simple, it's quick, it's inexpensive, and is usually used in field surveys and also during the period of emergencies. Skin fold thickness measurement makes use of calipers to measure the thickness of subcutaneous fat in the body. And common sites are the triceps, the biceps, the subscapular, and it is used to estimate the total body fat percentage, and very useful when you are doing research around obesity. Another investigation method in human nutrition is the biochemical assessment. And here you measure the nutrient level, metabolites, indicators of deficiency in blood, in urine, or in tissues. There are common tests that can be done. We have you can test the hemoglobin status, the serum ferritin, serum transferrin to detect iron status. You can also look at the serum albumin to assess the protein status. You could look at the serum retinol to determine if there is vitamin A deficiency. Iron the urinary iodine concentration to determine the iodine status, cholesterol, high density lipoprotein, low density lipoprotein, and triglycerides for lipid profiles, and also the fasting and random blood glucose level for the blood glucose level. These methods are many. These tests rather are many, and this is just to mention few. This method has numerous strengths, it's very objective and precise. It detects early or subclinical deficiency. It's very useful for evaluating intervention. And it also has its own limitation. It's very expensive. You need a trained laboratory personnel. It could be invasive, especially the procedures could be invasive. And then it requires transport and storage samples. Clinical assessment. Clinical assessment can also be called a physical assessment, where you examine the body for physical signs of nutrient deficiencies or excess. There are examples of clinical signs which include the pale conjunctiva, where you assess the iron deficiency anemia, or the PITOT spot to assess vitamin A deficiency, ODIMA to assess protein energy malnutrition, Goiter to assess iron deficiency, the cracked lips or tongue for B vitamins deficiency. The clinical assessment strength is that it is non-invasive. It is useful for identifying visible deficiencies. Limitation includes the fact that they cannot detect early deficiency or subclinical deficiency. And also, some signs are non-specific. That means some signs could be caused by other conditions. At this point, it is okay to say thank you for listening. Bye.